Female hair loss is a very complicated subject that has taken me volumes. I've written 9 textbooks on hair surgery and hair loss, and I could spend probably the next 3 hours talking about female hair loss. So what I'm going to really focus on right now is sort of the way that I approach female hair loss today in 2022 and what I do differently than what I did in the past. So I'm going to recap some of the basics of some very quickly a cursory way of just general ideas and then break down what I'm doing today. So I always say with female hair loss, I'm looking at determining between the cause and the effect. So in other words, the cause is something that could be low thyroid, it could be a genetic predisposition, it could be hormonal imbalances. There are a lot of reasons for female hair loss that are oftentimes more complex than just male pattern baldness, which we usually assume to be just DHT driven. So I always tell my female patients I don't treat the cause, I treat the effect. So I always encourage them to work with either a functional medicine doctor, their OBGYN, to check their laboratories, maybe a dermatologist if they need some spironolactone or various other detailed therapies to look at if there's a dermatologic condition that may be causing things. And I'll give the references as I think as appropriate for a patient if they haven't already pursued those. But I do treat the effect. In a way, today the effect is also partly to do with the cause, which I'll explain and it'll become a little bit clearer. But in general, I don't do all the investigative work that I think is helpful for female hair loss. And that, in other words, I don't look at all the causes, but I just give you guidance of where to go for that. The other thing that I try to divide into for women is into what I call stable and unstable. So if someone has stable hair loss and they have hair loss over 10 years and it's not significant, there's a discernible patch of hair loss that I could see that would merit restoration with a transplant, then that's my favorite candidate to do a surgery, because with very slow burning hair loss and they've got a distinct area that looks very weak, I'm not as worried about women going bald as men in terms of going frankly like a slick bald crown top. That surgery oftentimes is a good solution. But surgery is not the solution necessarily for everyone. And the cases that I think are not good for surgery are as follows. So one is sometimes women say, my hair is thinning and I can't put a graft between those hairs because there's not enough real estate for me to put a graft up there. And that person, a surgical option is really not good because I'm going to cause trauma. They're going to have shedding, and I may not even see a difference because I'm traumatizing their other hairs there. The other patient that's not a good surgical candidate is someone that is unstable. So if I put in 3 hair grafts in and you lose 6 hairs because your hairs are unstable, that's not good. We need to stabilize the hairs first. So what I'm dealing with is how do I treat in this podcast, how do I treat unstable female hair loss, or how do I just treat hair loss for women on a medical level? So for men, I go straight to prescription in most cases. Now, in 95% of cases, I go straight into prescription, which is finasteride minoxidil, because those are the most powerful and weapons against male pattern hair loss. And men go to oftentimes very extreme levels of baldness, whereas women can get very bald, they can get thin, but they don't go all the way bald. And oftentimes with female hair loss, it's not as much of an emergency to manage because, if I'm dealing with a 25-year-old man and he's really losing a lot of hair, if I don't get to him on time, by the time he's 35, he could be much balder than he would otherwise be. So with women, what I'm trying to do is not necessarily just jump the gun and go toward a prescription strength therapy. I'm actually making a much more conscientious decision of which way to go. So I divide medical therapy for women into prescription therapies or chemical therapies and natural therapies. So natural therapies are actually very, very effective for women. They also are very effective for men, but as I said, because the male hair loss is so relentless, I don't just go to natural therapies as first. For women, oftentimes I will, because I find incredible reversal with natural therapies, not just some kind of homeopathic, barely perceived results. I'm talking about significant growth with no need to go to the prescription level therapies, which is really good. So the 2 natural therapies that I love that make huge impacts for women are going to be hair stem therapy, and I encourage you to listen to my podcast I recently shot on that because I'm not going to go into that. But basically, they're biomimetic, plant-based therapies that require, there's no pain. Like PRP injections are very variable in the results because the growth factors in your blood are variable and it hurts. This is a very easy therapy that makes huge difference. That's all natural, plant-based therapy that makes big differences that you can get to doing it twice a year. It's very simple and very powerful. The other therapy that I love is my FolliFlow. Plant-based therapy, you think it's not going to do much. It is incredible what it does. In fact, I've completely sold out on Amazon. I'm trying to get my supplier every day. I'm working on re-upping this. But it's an incredible therapy. My au pair had mounds of shedding that was all over the our Roombas, clogging them. And my wife, like within 2 weeks, and minoxidil came to work this fast, had all her hair was gone. It was full head of hair. It was not shedding anymore, and it's incredibly powerful. So unfortunately, at the time of this podcast, you will not be able to purchase FolliFlow, FOLLIFLO on Amazon, but I am working to re-up this as soon as I can. Literally on a daily basis, I'm working to get the supply chain issue resolved. But FolliFlow, it takes 2 seconds, sprays on your scalp. It's all natural plant therapy, and it's massive in what it can do for women. So those two are oftentimes my go-to for women before I even begin to think about finasteride, minoxidil, or anything else for them. But some women are just opposed to natural. They just don't think it works. They don't want to do it. Whatever it is, they're like I love minoxidil. I want to do it. So what's interesting is with minoxidil therapy, there about 30 to 50% of people out there have a very reduced sulfotransferase enzyme in their in their scalp. So topical minoxidil doesn't work very well. And so an oral minoxidil may be of greater benefit. Oral minoxidil, I think I did a podcast on this a little while ago, I'm pretty certain. If not, here's a quick summary, is sometimes more effective than topical minoxidil. You say, well, how do you know if one or the other? Should you just try it empirically? Well, I'm doing something called the hair genome test, which is really awesome. It's a buccal swab. And within 3 weeks, I get a multi-page report, not only of do you have a sulfotransferase issue, what dose of topical minoxidil. A lot of people, they just give standard 5%, or you know what, I'm going to give you 12% minoxidil because it's more effective. Is it? It's not tailored to you. They're just giving you a high percentage of minoxidil, and you don't even need that chemical load. So what this does is it literally spits out a specific percentage that your body needs for it. For example, if you said, look, I don't want oral minoxidil, I want topical minoxidil, it will give me an exact percentage you need. It will even tell me what vitamin deficiencies you have for your hair if you want to do natural therapies. But in general, to me, it's overkill. If you're going to go the natural route, my two other therapies, the FolliFlow and hair stem, are so overwhelmingly powerful, I don't even necessarily need to get you on vitamins. But vitamins are really good, but it'll tell you exactly what vitamin deficiencies you have with this hair stem therapy. So it's very, I'm sorry, not hair stem, hair genome test that gives you so much data. And for example, if you are a woman of childbearing age, I generally don't like to use finasteride because it has birth defect risk. But what's powerful with this is that if you are not going to have children or you're postmenopausal and you want finasteride, well, what dose of finasteride? If you're doing an oral regimen, I pretty much start a standard 2.5 or 5 milligrams for finasteride and 2.5 milligrams oral for oral. But if you're topical, a lot of times topical formulations are quite standardized. Every one size fits all. But finasteride, some people have a higher resistance to finasteride. And so they're on a finasteride, they're not getting the effect of it. I need to up it. Or maybe they need a topical dutasteride. And you don't know that because you're getting a standard therapy. There's also, some people put glucocorticoid in there, and you may not even have a glucocorticoid, in other words, steroid sensitivity. So you're getting steroid in there, and you don't even need the steroid. This will give me a lot of data points where I'm actually getting a very good read of do you need a glucocorticoid or not. And so when do tretinoin. People say, do I need tretinoin? Oftentimes you do, oftentimes you don't. It depends on your sensitivity. This report will give me all that data point. So in general, unless you're just going to do an oral dose, if you're going to look at a topical formulation, I usually like to use this test to help me sort of carve out exactly the formulation I need. For an oral dose, it's more or less standardized. You're bypassing the sulfotransferase issue. I'm not as focused on absolutely needing a genomic test for evaluation, but some people just want all the data they can, and they want to know their vitamin deficiencies, so I will do that test for them. So that's that in a nutshell. So, well, when do you use natural? When do you use chemicals? I sort of gave you a hint that most times I'm going natural as my first go-to for women because of the efficacy and the fact that I can avoid chemicals. But for women that are like a Ludwig 3, they're rapidly shedding, they're really, really, even rapidly shedding, I can actually manage pretty effectively on the side of the natural side. But if women are very advanced baldness, and I need all my tools in my belt, like what's called a Ludwig 3, which is like super see-through, I will encourage them to consider doing it all at one shot. Now, if they're in a hurry to get this rebuilt, but of course, the benefit of doing one at a time is I get the understanding of what each thing does and what benefit it has. But that's sort of the exception where I have someone with very advanced baldness, and I think, you know what, I need to get them on everything I can right now. Let's go and hit them both chemical and natural. Or as I said, as someone just says, look, hey, minoxidil's worked for me in the past. I would love to tweak my therapy and regimen. Let's go that route. Then I'm going to go that route instead of the natural route, or I'll combine it. So those are sort of my philosophical perspectives, sort of 2022. We're at the end of this year anyway, so going into 2023 is how I see female hair loss evaluation and intervention.